Recent data by group Ritshidze has revealed that HIV patients in South Africa have complained about the poor treatment received at healthcare facilities, which saw them missing their appointments and even stopping the clinic visits. The data reveal uncaring attitudes, lack of treatment, literacy, information, and patient confidentiality in Gauteng clinics, unfriendly services and lack of privacy amongst 9 key issues outlined in the 3rd edition of a new Ritshidze State of Health report in the province. Statistics show that 25% of staff shouted at them when they go for medication, with 21% saying the staff sent them to the back of the queue and they lack privacy in this state of health. Now, join us to speak on this and more. We have Ritshidze Project Officer Bellinda Setshogelo joining from South Africa. A warm welcome to you, Bellinda. Hello, Bellinda, are you there? Can you kindly unmute your mic, please? Bellinda, yes, quite a devastating state of health report on how people living with HIV are treated, especially from places and people that seek health care from. Can you tell us more about this data findings?
Okay, so Ritshidze have been monitoring facilities around 123 to be precise in the Gauteng province, and we're also monitoring in 8 other provinces. Overall, we're monitoring about 420 Cienza facilities. So there are common issues that comes out often in the report, although we acknowledge that there are some improvements that are happening in the facilities. For example, issues of cleanliness and infrastructures, issues of patients at some level knowing their viral loads and the importance of adhering to their treatment. However, there are still major challenges that are common across the districts in Gauteng that we're launching the report this week. The issues of TB infection control in all the facilities that are monitored, 123 in Gauteng, there is no even one facility that got a green score in terms of TB infection control. So meaning that there are no improvements on that matter, and this is a problem because it keeps on putting the lives of patients in danger. The issue of TB infection control is mostly caused by overcrowding in facilities that do not have enough space. And some of the facilities are old built and the windows are too high and too often they are not opened. And there is no screening. We've seen during COVID, things moved rapidly where people have been screened for COVID, people have been wearing masks, but with TB, it's not a case. Whilst we all know that TB is the first most killer in South Africa, particularly for people living with HIV. And then other most common issues,
Now, Bellinda, what laws are available to protect patients from such behavior from the health personnel?
So there are laws that requires the facility to screen patients for TB, also separate them from those that are coughing in the facilities, and also attend to them first so that they don't stay too long in the facilities. However, due to the constraints of issues like the shortage of staff in facilities, the facility managers find themselves in those predicaments.
Now, Bellinda, now that the report is out and it's, we've seen the shocking details of those reports, how do we address these challenges? Are you going to take these grievances to the South African Health Ministry?
So fortunately today, the MEC of Health was part of our meeting, and we had agreed that we're going to have further engagement, which are planned in this quarter to articulate more on the report. And we also made recommendations that required the government to act on some of the issues. Some have deadlines of January 2023, and we'll be monitoring that they are implementing those recommendations and so to improve services for people living with HIV.
Finally, we understand that these are not only the shortcomings in the health department in South Africa, also the challenges are faced by the public.
I didn't get that.
These are not the only challenges faced by the health department in South Africa. What all the challenges are there, and what is the government doing to improve on it?
So there are a lot of issues, like issues of human resource. That's the most problematic issue in our health department, where staff, when they leave for retirements or people passed away, especially even during COVID, people are not replaced. In Tshwane alone, we are sitting at vacant position of 151. And this rates from cadres of professional nurses, enrolled nurses, data capturers, which are key to ensuring improved healthcare services are provided in our department. Also, the ARV refill, it's very slow in South Africa. This is the reason that sometimes the clinic is without medication, and they feel they cannot give other patients more medicines while they do not have enough, rating to issues of storage and infrastructure challenges. We feel like now with the new MEC that has came in, we're hoping that there will be some improvement in the healthcare, because she's promising and she's hands-on and she's always at the ground. So we are really hoping that there will be a change. Some of the issues we've been raising for years, ever since we started with the program, we've been raising the same issues of staff attitude, of long waiting time. Although there is a policy of a circular of May 2019 that was issued by the Department of Health, that to try and decongest the facilities, people must be decanted one, and the facility needs to open at least at 5 a.m. on weekdays and also open on the weekend, but that is not happening in all the facilities around Gauteng. And the facility managers are stating issues of understaffed, as I've already mentioned. They are mentioning issues of safety in their area, because also they don't have enough security.
Thank you very much, Bellinda Setshogelo of Ritshidze project. It was a pleasure having you join us in the news. Thank you.
Thank you very much.